Sleep disorders. What happens when you don't sleep, quote unquote, perfectly? Starting with insomnia. How many of you know people with insomnia? So our definition of insomnia is someone reporting that they're not getting sleep. Now, the difference between insomnia and some of the other sleeping disorders is insomnia, you go into your general practitioner and you say, I'm not sleeping very well. And they say, let's talk about that. After a short conversation, they say, here's a prescription. There you go. Is there any basis behind this other than the person saying, I'm not sleeping? No. So it's based upon one person's report. So Janelle was asking, is this something that happens a little more commonly and possibly is misdiagnosed? Possibly. Now, this is my own personal opinion. Take it for what you think, and we can argue about it if you like. But in the United States, we like drugs. You're not sleeping? Here's a drug. There you go. Not to discredit this insomnia, because insomnia does definitely happen, but sometimes I think we jump to drugs. So what the prevalence rate is right now is that 15% of people reporting that they're not getting enough sleep. If we actually did studies, this might change a little bit. And this prevalence rate increases with age. Causes. What do you think may be some causes of insomnia? Stress is a big one. Diet. I don't have that one up here, but yes, absolutely. If I drink a lot of caffeine, do you think that might affect my sleeping? Alcohol and drug use. Exercise, lack of exercise. One other big one, as you age, this tends to happen. There you go. Physical problems, such as back pain. As you age, your body tends to break down. You get more aches, more pains, more uncomfortable. Anxiety and stress we hit on. And drugs, of course. Treatment for insomnia. How do we treat this fun thing? With drugs. That is our favorite method. So treatment, a problem with medication. This is what your book focuses on more. You have insomnia, you take a sleeping pill, you develop a tolerance. Now you need to take 2 sleeping pills. You develop a tolerance. Now you take 3 sleeping pills. And I have nothing against sleeping pills. It kind of sounds like that, I realize. I have nothing against sleeping pills. If you're not sleeping, then sleeping pills are amazing. They help you get what you need so that your body can function. However, there is a downside to some of these, not all of these. One of them being tolerance. And the other one that we talked about is your REM sleep, how it affects your REM sleep. However, getting no sleep versus getting all sleep but REM, it's better to get some sleep than to get no sleep. So there you go with treatment. Avoiding mental effort before sleep. This is where we get into a little more non-drug related. Sometimes as Americans, we like to go, 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 sleep, go, 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 sleep. And we kind of forget that, oh yeah, we need to unwind a little bit before we force our bodies into sleep. Start relaxing earlier. Instead of giving yourself 10 minutes to relax, give yourself an hour, maybe 2. Your book lists a bunch more that you can do. Drink milk, use dimmer lights, exercise, but not right before you go to bed. More sleeping disorders, narcolepsy. 1 out of 1,000 individuals. Sudden and irresistible onsets of sleep for a maximum of 5 minutes. You go straight into REM. So I would be up here teaching, and then all of a sudden, and then I'd come back. Back in your book, talks about what causes this to come about. Anybody remember what that is? Situations where this tends to happen more often? High arousal rate. So a lot of times this happens when you're in the midst of a fight. So you're getting really heated up. You're going along, and then all of a sudden you're trying to make your point, and you're out. And then you come back up, and you keep going. Yes, that's the other time it tends to happen. So during arguments, during sex. Yeah, those are the 2 biggies. So sudden and irresistible onsets of sleep straight into REM. If you're having a fight with your spouse, this might be a very convenient time for it to happen. If you are in bed with them, maybe not a very convenient time for this to happen. So narcolepsy, overall, it sounds kind of funny, right? Here you are, you're talking to somebody, all of a sudden, boom, they pass out for about 5 minutes, boom, they come back. On the serious side, what if they're driving a car? Not so funny. It can happen when they're standing up. It can happen when they're sitting down. A few things about narcolepsy and specifically driving. If you have it under control, they will give you a license so that you can drive. If you're under drugs and you've gone so long without. Also, sometimes people can feel narcolepsy coming on which is a good thing so that you can pull off the road, have your narcoleptic attack, and then come back up. So even though narcolepsy sounds kind of funny, there is a serious side to it, just to keep that in mind. Sleep apnea, moving on to, so that we can get this covered, is frequent reflexive gasping for air that awakens a person and disrupts sleep. It can become severe enough where if you cannot bring yourself out of it, a lot of people, and I shouldn't say a lot of people, some people will have the sleeping mask so that they continually get oxygen regardless of if this is happening. Some people, they realize they have it, but they don't go on drugs. They don't take oxygen. They just kind of deal with it. So again, there's different severities. So stop breathing for 15 to 60 seconds, wake yourself up, go back to sleep. Wake yourself up, go back to sleep over and over throughout the night. Tends to happen in people who are a little more obese, more so than those who are not. Sleepwalking occurs during slow wave sleep, which is during what stages? 3 and 4. Children 11 to 12. It can happen younger, it can happen older. There's stories of people driving to work, but they're sleepwalking the whole time. So it can happen at all ages. We see it a little more prevalently, 11 through 12 is a huge spike there. Contrary to popular old wives' tales, you can gently awaken somebody who is sleepwalking. Back in the day, they said, do not wake somebody who's sleepwalking. They will be frozen in that state. That is not true. However, we got into a conversation in a different class where somebody was making a sandwich. A father-in-law came and woke him up, and he stabbed him. So if they have a knife, do not wake them up. Let them put the knife down, walk away. Apparently, it can startle people when you wake them up. So make sure you're in a safe environment and then gently awaken them. Yeah, scary stuff. Okay, here's another graph. We're going to take a look at this. Sleepwalking, according to this graph, tends to happen when? So here there's a tiny little line, if you can see that. Stage 3. So sleepwalking tends to happen during stage 3, if you would like to specify that, which you will for the quiz that will be coming up. Sleepwalking tends to happen in 3 and 4. Here we're going to specifically say 3. If we look at night terrors, let's talk about night terrors. When do night terrors occur? Stage 4. What else do you notice? Every stage 4, or what happens in the beginning of our sleep? So if this is us sleeping, this is our first hour of sleep, our second hour of sleep, third, fourth, fifth, sixth, so on and so forth. It tends to happen during the first couple hours of sleep. So starting with night terrors, awakening from slow wave sleep, specifically you can designate stage 4. You wake up with intense feelings of panic. Now under this, does it say anything about awakening from a really bad dream? No. You're not in REM, so you're not going to be dreaming. So when you wake up from a bad dream, that's going to be something else. It occurs during stage 4, which again is not a dream time. So what happens is you wake up and you feel this incredible panic, and then eventually, hopefully, it'll lessen so that you can go back into your sleep. Okay, so this is not dream related. Also, if you want to jot down, which I think you probably will, it happens the first couple hours of the night. So why does this not happen towards hour 6, 7, 8 of sleep? Because you don't have stage 4 later on in the night. So you can't have night terrors in the early morning or in the late hours of your sleeping. Okay, if we take a look at nightmares. Nightmares happen during what stage? REM. So here is where we get our very, very, very scary dreams. So these dreams are very detailed. When you wake up, you can remember very specific details. Oftentimes, either inside of the dream or outside the dream, you have a paralysis, so you cannot move, you cannot scream, you are frozen. And then upon waking up as well, there tends to be an inability to move. And then to make note, nightmares, do they happen at the beginning hours of sleep or at the end hours of sleep? The end, the later hours. All the red ones are REM sleep. Nightmares themselves tend to happen over here. Yep, early morning or the late hours of sleep. Okay, so here we go. Reporting one is not getting enough sleep. It's called narcolepsy, night terrors, nightmares, sleep apnea, or insomnia. Hold it into your head for a second. Don't say it out loud. What is the correct answer? E, insomnia. How about this one? This would occur around hour 6 of sleep. Rather, then the second hour of sleep. Nightmare, night terrors, sleepwalking, insomnia around hour 6. Correct answer would be A, nightmares. Reflexive gasping for air is a symptom of which of the following? Sleep apnea, narcolepsy, insomnia, night terror. A, sleep apnea. This tends to occur during slow wave sleep. Night terrors, sleepwalking, nightmares, both A and B, or both B and C. Correct answer is D, both A and B, night terrors and sleepwalking. Okay, to help you study for this exam over sleep, study the way that you always do. One extra thing to help you is divide up our different stages. So if we take a look at REM sleep, tell me everything you know about REM. What happens during REM? Dreams. What else? Alpha. Nightmares. Sleepwalking is during what stage? 4. I don't know. What do you know? Stage 3 and 4, night terrors. Specifically, we said 4. Eye movement for REM. Okay, so you get the general idea. We're not going to go through and do all of these, but go through your notes. Stage 1, what type of waves are there? Stage 2, what type of waves are there? Stage 3, what type of waves are there? 4, REM. So make sure you know what waves happen where, what disorders happen where, what funny things happen everywhere else, if there's any nicknames. So fill these out. The reason why is for multiple choice questions can go one of 2 ways. It can say alpha waves occur during what stage, and you'll have to pick it out. Or during REM, what type of brain waves do you see? And you'll have to pick out alpha waves. So this way it kind of categorizes everything so you can pick out what specifically happens where no matter what the question is. Good?
And that's it for sleep. Check out D2L, see what you all need to do for this week, and let me know if you have any questions.